we need to do more than that, as the review makes very, very clear. Deaths in mental health settings should be investigated in the same way that deaths in any other form of state detention are investigated. If someone dies in prison or in a police cell, there's an automatic external investigation by an independent national body that publishes a final report and shares the learning of what they've found. But if someone dies in a mental health setting, as Shaney Lewis did, there is no such fully independent investigation. In Shaney's case, the Health Trust investigated itself, and lessons that needed to be learned were not learned. And due to errors by the IPCC, the Metropolitan Police were able to block an inquest opening for a full 7 years after that death occurred. It should not be possible for the organisation under investigation to be able to control the scope, timeliness, quality and content of the report into their own potential failure because of the risk of a cover-up. Now, I pay particular tribute to the powerful campaigning work carried out by the charity Inquests on this issue, and I fully support their demand for non-means-tested legal aid to be available to families at inquests, so there's a level playing field between the bereaved family and the well-funded organisations accused of potential wrongdoing. Those investigations must be conducted by fully independent bodies that command the confidence of the public and the confidence of bereaved families. By failing to learn from preventable mental health deaths, we condemn other vulnerable people to the same tragic fate. Shaney Lewis died in the most horrific circumstances, and his parents then had to fight for 7 years for justice and just to find out what had gone wrong. Shaney's law stands as a testament to his life, but it's time to go further, and the review of the Mental Health Act creates that opportunity. We need to make sure that every bereaved family can get the justice they deserve, and we need to make sure, through a fully independent system, that every lesson we need to learn is learnt and acted on so that we can keep every vulnerable person with mental ill health safe in future.